Hello friends. Today we are going to discuss about components of dialectical behavioral therapy. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at NIMANS, Bangalore. Before I start my presentation, I would like to place this disclaimer. This presentation is for academic and training purpose only. For clinical opinion, please do contact a psychiatrist. Conflict of interest? None. Let's discuss about the components of dialectical behavioral therapy. And this video is targeted to psychiatrists, doctors, nurses, mental health professionals, psychotherapists, and counselors. Dialectical behavioral therapy was developed by Marsha Linehan. Initially, she tried to treat patients with borderline personality disorder, suicidal patient, deliberate self-harm by using cognitive behavioral therapy. Unfortunately, the cognitive behavioral therapy was unable to answer emotional dysregulation and also the interpersonal problems, especially in borderline patients. In such a scenario, Marsha Linehan came up with dialectical behavioral therapy. Let's understand what are those components of dialectical behavioral therapy which moved away from cognitive behavioral therapy to a certain extent. There are four important components of dialectical behavioral therapy. One is individual psychotherapy. Second one is group skills training, which is very important component of dialectical behavioral therapy. Telephone coaching and therapist consultation team. So these four important components should be there for dialectical behavioral therapy, which is coined, developed by Marsha Linehan. She clearly said that although individual psychotherapy is required weekly once, but skill training has to occur in a group. That group therapy will be consisted of 6 to 8 clients who may be homogeneous or heterogeneous in their disorders. By learning these skills, they need to employ at the same time they need to use these skills in real life scenario. In real life scenario, it may not work. In such a scenario, if the patient is going to have a crisis, the patient will make telephone call to the individual therapist. Through telephone call, the client is supported by the therapist. And here, in such a scenario where the therapist is providing care for emotional dysregulation, in such a scenario, the therapist also will go through emotional turmoil or else will have burnout. Hence, the therapist need to be in touch with therapist consultation team or else DBT consultation team. Without a DBT consultation team, there is no DBT as per Marsha Linehan. That means before you venture into DBT, you need to have a DBT consultation team in the locality, and those people need to meet every week once and discuss about the difficult therapy which is going through, what are the difficulties the therapist is facing, what are the support, and also at the same time, this team will help the therapist to be within the DBT framework. These important four components are individual therapy, as I mentioned, skills training, telephone counseling, and consultation team. But here in skills training, there are four important skills need to be taught to the client, and this occurs in group therapy. In group skills training, first one is mindfulness has to be taught to the client. Interpersonal skills that needs to be taught. Emotional regulations has to be taught. And finally, crisis management or distress tolerance has to be taught. So here we are using all methodology to help the client. Individual therapy, skills training, and in real life scenario, whenever the patient is going through a crisis, telephone counseling, and finally, the therapist also requires support. Hence, DBT consultation team. These are the important components of DBT. But however, DBT skills training needs to be too precise. And that skills are, as I mentioned, mindful skills, interpersonal skills, emotional regulation, and distress tolerance. DBT is designed basically keeping to enhance the capability of skills. Skillful behavior need to be enhanced. Motivation to change and engaging the patient in the therapy is very essential to ensure the skills which are learned are generalized in real life scenario. So these are the three important objectives have been kept. Finally, Clients need supporting and maintaining advancement towards the goal. That means the client, although we are accepting, the unconditional acceptance is there, but we need to constantly help the client to move towards from painful situation to the painless environment. That growth should be constant, and it needs supporting and maintaining advancement towards the goal of the client. At the final, to enhance the therapist motivation and to deliver effective treatment in DBT framework, there should be a DBT client. So these are the designed which are very essential part of DBT. Finally, the DBT also have certain agreement of the clients. Those are the client need to be in therapy for 1 year, weekly 1 week session in individual therapy, one session in skills training, and therapy will be considered as discontinued if 4 consecutive sessions are missed. That means if the client does not come for 4 consecutive sessions, that means he need to attend the new course later. Work towards terminating the deliberate self-harm need to be accepted by the client. And also the client need to participate in skills training, and the payment has to be clearly understood by the client. At the same time, DBT therapist also need to make certain agreement. That is maintaining competence. How to maintain? By attending the DBT consultation team, providing professional treatment. Even though the DBT therapist, when they are providing services to the borderline clients, emotionally turmoil patients, the therapist need to maintain his integrity and professional courtesy. At the same time, the professional treatment should not be deviated. That is very essential. And initially, the therapist need to be available for weekly consultation and also for telephone consultation. Finally, the therapist need to respect the confidentiality of the client, and the therapist need to attend the consultation team. Without that, there is no DBT. Treat the patient with respect and humanly. At the same time, abide the DBT consultation team's advice. That is very essential. The whole DBT can be considered as learning, unlearning, and relearning. There is nothing called as DBT therapist is completely mastered. Every DBT therapist need to attend DBT consultation team. That means every day you need to learn. That is, curiosity should be there. You need to have a courage telling that I was wrong, unlearn it, and commence relearning. So, learning, unlearning, and relearning is an important ingredient of dialectical behavioral therapy. Hence, to conclude, my dear friends, dialectical behavioral therapy components theory revolves around it is a multimodal intervention, that is, individual therapy, skills training, and telephone counseling. Along with that, the therapist requires support. All these 4 components forms dialectical behavioral therapy. Thank you very much for giving your valuable time. Stay safe.